Good afternoon, and welcome to the Department of Behavioral Health Weekly Update. I think you all know, Dewan UTEC. All right, it's still Mental Health Month, so throughout the month, I'll continue to remind us and also remind you to keep track of our Facebook page and our Instagram and our web page. And also you can go to stigmafreefresno.com, where we also have a lot of great resources. And keep an eye on your inbox, where we're pushing out, Brian is pushing out a lot of fun things to do. And then also a reminder of the Guiding Principles in Action Awards that were announced during the staff meeting. And those are where you can look at our guiding principles and you can nominate one of your coworkers who you think really. Good afternoon. And welcome. Hold on a second. Department of Behavioral. Sorry, my phone was talking to me. Anyhow, you can nominate one of your coworkers who you feel really demonstrates those guiding principles in action, and we'll be giving certificates to all of the nominees, as well as some raffle awards that will be fun for people who've been nominated. All right. So by the numbers, this is last week. Remember, we had about 3.7 million cases in the world, and about almost 260,000 deaths. And in the United States, 1.2 million, a little over that, and 71,000 deaths. And we're now up over 4.3 million, so several hundred thousand increase on the cases in the world, and almost 300,000 deaths. And then in the United States, 1.38 million, and a little over 83,000 deaths. In California, we went from 56,212 cases last week to 69,382, and 2,317 deaths to 2,847 deaths. And in Fresno County, our case rate is going up to 984 cases as of yesterday afternoon, and 10 deaths. We have seen 3 deaths in the last couple of weeks, and those are largely from long-term care facilities. In terms of what we're doing, remember we talked last week about how telework would continue through the end of May at a minimum. That's something that we'll be looking at on a week-by-week basis. I would say that some telework most likely will continue beyond May, and we'll take whatever amount of time we need within reason to do the work we have to do to safely return people to work. So in terms of analyzing the return to work requirement, and I put down requirement, but really those are the requirements are that we have to look at particular things in order to create a safe workplace. So as I've mentioned before, your entrance and how you leave the building, how we're going to deal with common areas, masking, will you wear a mask, will you not wear a mask, and then workspace configuration. So we do have an outside entity looking at all of our work areas and making recommendations on either modifications that have to be made in order for the current configuration to continue, or changes to the current configuration in order to comply with a safe workplace. And that is going to take a little bit of time. So we won't be bringing people back to work until all of this work is done, we're satisfied with the work, and we've created a safe environment. So as part of that, we'll be assessing telework both in terms of short-term and long-term. And what I mean by that, I've had questions pretty much at every meeting about what, are there some positions that could continue telework indefinitely or permanently? And that is something we will be looking at likely in the coming several weeks. We'll be doing some sort of survey. Dr. Tran and the medical team had a great idea of asking the people that we're serving how they prefer to receive services. We anticipate that, much like many of you, we have some individuals we serve who would prefer to continue being served through telehealth and telephone, and others where it doesn't work for them. And just like some of you with telework, some of them have technology issues, or they're lacking all of the proper equipment, or they may just have difficulty with privacy or finding what they consider a safe space to engage in telehealth. And so we think that by doing a survey, we can get a more informed set of information to be able to make some decisions about what positions or work that gets done in our department could be done via telework. So that's going to be an ongoing thing. Even when we get to the point where we're bringing people back to work, it's not to say that we might decide at that point that something could be telework and later decide it's not working out. And also we could bring somebody back or certain positions back and then later decide that we either they can efficiently and effectively do their work at home, or we might also have some technology issues that we've been able to address that make it easier. So I don't have a permanent decision. I don't have a set rule about how that's going to work, but I can reassure you that we continue to assess that, and we will be making decisions based on what I described. You should anticipate that the daily remote health screening is going to continue. You might have gotten an email this week from Helen about a tool that's available through the Fresno County, it's called Go Fresno website, and I'm going to show it to you real quick here. And it's called a facility pre-screening. So you open up this Fresno County Go Fresno app, and then there is, so it's basically those health questions, and if I say I don't check any of them, then I get this green check, and it just takes a second to do. It's not something that gets recorded with my name anywhere, so that information you provide to your supervisor still needs to happen. But when you're entering a building, and I use it because sometimes I go downtown to the Hall of Records or other places, public health, and if I have this, then I don't have to go through that screening process when I get there. I can just show this. So it's really a convenience tool, and it's also a tool so that individuals who are from other departments who come to our department or work at our department, like security guards, can easily see that people have passed the screening. And so we feel a little conflicted about this, right? Because it seems like through this process, the process has changed. We've had handwritten screening tools that we each completed individually. We then went to people standing at a door sometimes and asking the questions, and we went online. And it can feel like, oh, that's a different day. They're always changing it. And, you know, this is just one of those things that we kind of have to have patience with, because the county is trying to develop strategies and resources for us that make it easier. This is one. It's not a be-all, end-all. It doesn't solve all of our problems, but it does solve that problem that when you're walking into a building, you could show that, and it makes it much quicker and easier for you and for the person who's screening you. So you should anticipate that that will continue. All right, so I thought today I would really try and focus on what is this reopening process, and what does California expect, what's expected of counties. You know, there's a lot of conflict and tension right now in lots of different communities, including ours. You might have seen in the Fresno Bee that one of our council members got, protesters at his home last night, and it was an altercation, and just a lot of stress and tension, and a lot of political divide about whether we should reopen, how quickly we reopen, whether you should wear a mask, etc. And so I thought it would be important for you all to hear about what are the actual written steps that the state is expecting counties to comply with. So stage one, which we've been in pretty much from the time it started, is safety and preparedness. And I think last week I shared a slide with you that talked about what's it going to take. And so that was what does it take for stage one? And that is building up testing and contact tracing, having adequate personal protective equipment. In the very beginning of this pandemic, we didn't have enough, and now we're kind of getting where we probably do. And hospital capacity. So for surge capacity, initially hospitals canceled a lot of elective surgeries. In some cases almost all elective surgery. They repurpose things like post-surgical units where people recover from surgery into ICUs, and they try to reserve those ventilators for people who might get sick with COVID. So in that stage, they were creating hospital capacity for that. And then prioritizing safety for workers and customers in essential workplaces, and essential workplaces includes places like grocery stores and Target and things like that we go to. And then preparing safety guidelines for an expanded workforce and really trying to determine what would it take for each industry to get to the place that we could slowly reopen. Remember, initially, as we were learning about the virus and understanding in some areas like in Italy and in New York City, where truly hospital systems were overwhelmed, that's what we were trying to avoid here. And so we did avoid it, and now part of our society believes that we went too far. We didn't have to do that much. It wasn't that bad here. And I think I showed a slide a few weeks ago that basically says, oh good, our measures worked. When people think you did too much, that means public health measures worked. But always we had in mind that we would attempt to reopen and hope that our mitigation strategies could be put in place, again, to slow down the spread. Nothing we do at this point will eliminate COVID until we have a vaccine. And so all of our efforts moving forward are about slowing down the spread. That doesn't mean no one else will get COVID. People will get COVID. That doesn't mean no one else will get hospitalized. People will get hospitalized. That doesn't mean no one will die of COVID. People are going to continue to die of COVID. What we're trying to do is have the pace of all of that happening be such that the system can accommodate it, and also that people don't die because the system was too impacted, that there wasn't enough of workers or equipment or space for people to be cared for COVID, as well as other life-threatening diseases, that if the hospital was overwhelmed with COVID and you have a heart attack, it might be harder to treat someone with a heart attack. So it's all the things that they were looking at in stage one, is what would need to be in place, what would be the measures we'd need to have in order to start to reopen. So that takes us into stage two, which is where we're at now. And this is where you gradually open some lower risk businesses and workplaces and adapt them for social distancing. So just like I talked about what we're doing in our department to consider bringing people back, that's what's happened in grocery stores. I don't know about you, but I saw things change over the last several weeks. You begin to see the plexiglass screens go up, stop bringing in your own personal reusable bags, people standing at the front of the store wiping down your shopping cart for you. In the beginning, I wouldn't even take a shopping cart. I just carried everything around in my arms. Well, in the beginning I brought a reusable bag, but then they told me I couldn't bring that anymore. And then requirements for masking, and then starting to see on floors and things, and the reminder about physical distancing. And so I don't know about you, but my shopping cart at most of the stores I go to, sometimes I have to wait in line to get in the store. They're counting how many people are in the store so that it doesn't get crowded. And then when you're waiting in line, standing far apart. So those are the things that we're looking at now. How do we adapt the reopening for social distancing? Curbside pickup for retail businesses, so that started this week, where some businesses that were not allowed to reopen fully, but now could do curbside pickup. And then manufacturing businesses getting to reopen, and then office workers beginning to return if it can be a safe workspace and telework's not possible, and then just increasing access to public spaces. So this week on Monday, the parks reopened, and so starting to lessen some of the restrictions. It doesn't mean COVID's gone, though. It just means that if we're all able to comply with these recommendations, we can live with COVID. We can deal with the impacts of COVID while we try and live our normal lives. What ends up happening is if our efforts don't work, we end up having to go back to the shutdown. So I highly encourage people to follow the rules. I know there's a lot of discussion about a conflict with our rights and our freedoms and our independence as people and a nation. And I would just say this is one of those times where we really have to balance those things. Our right to be free and make choices and go where we want to go, with considering other people who might be impacted by those choices. And I really think about it like speed limits, right? I mean, as a person with independence and right, why can't I drive down Friant as fast as I want? Well, because it's not safe, right? Because there's curves in the road, and there's other people on the road, and people go in both directions, and there's bicyclists, and so there's speed limits and that type of thing. And that's just what we're dealing with now. We know that COVID is with us, and so we're trying to put the rules in place that allow us to all be on the highway and not have accidents all the time, while understanding that sometimes there will be accidents, while understanding that sometimes the fog will come in, or someone will drink and drive and there's going to be an accident. But the rules of the road are such that most of the time we can get in our cars and drive places and be okay. And that's what we're trying to accomplish with all of these recommendations with COVID, is be able to live our lives with some restrictions on our ability to do that, wearing a mask, staying 6 feet apart, etc., and get through this. All right. Stage 3, higher risk workplaces, is where the you start to reopen higher risk, but with some restrictions on gathering sizes and other limits. So places like restaurants and such, where you might not allow all of the tables to be utilized. Salons and gyms reopen with restrictions. Sports without live audiences, and maybe some movie theaters with restrictions. And religious services return to in-person settings. All of these things are things I've heard people talk about and post on social media, and open the salons. And I get my nails done and I get pedicures. But boy, I'm sitting there really close to someone for a long time. And so if we don't put the proper rules in place, we're putting their lives at risk. Maybe my freedoms are infringed upon, but we're putting the workers' lives at risk. And I just don't think my nails are worth it. They're really short right now. Did them myself. End of stay-at-home order is stage 4. Obviously, we're really far away from this. And this is basically where everything goes back to normal. And we've got either appropriate treatments or vaccine, where the incidence of COVID is more like what we experience with the seasonal flu. And so those are the different stages. I wanted to break down a little more stage 2, because this is where we're at, and I want you to understand the very specific metrics that the state is using in order for counties to proceed through stage 2. And at the end, I'll talk a little bit about the governor and the state is allowing some counties to move faster through stage 2. There's just some additional requirements. So the first one is epidemiological stability of COVID-2. And this is where they want to see no more than 1 COVID case per 10,000 population in the past 14 days prior to you attesting that you're done with stage 2. And for Fresno County, this would be 100 cases in 7 days. We're not there yet. No COVID death in the past 14 days prior to the submission date. We're not there yet either. I will mention that the 10th COVID death that was recently reported in the last 2 days did not occur in the last 2 days, and that's one of the challenges we have, is that sometimes it takes a while for a death certificate to be produced that declares an official cause of death. And it can take a little while to determine that the cause was COVID. And so some of the deaths may have actually occurred prior. So for the no COVID death in the past 14 days, it won't be when the death certificate will look specifically at when the person actually died. So we may be close on that one. And then protection of stage 1 essential workers, and that is where the physical environment is right. That's what we're doing for our department. And then availability of supplies, that we have enough disinfectants and masks and gloves or anything that we need to protect essential workers. And that could be everything from our frontline medical staff workers who are still interacting with clients, to grocery store workers, to other staff who might be coming into work that we just want to keep safe. And so that one we're doing pretty good on. in terms of our ability to construct a safe work environment and have the proper equipment. It might take a little time to put extra plexiglass and that type of thing in place, maybe signage and such, but those are all things we can do and we feel like we have the capacity to do. Testing capacity. This is where we have a minimum daily testing volume to test 1.5 people per 1,000 residents. And that can be a combination of where you're testing symptomatic people as well as what's called targeted surveillance. So that's just allowing anyone to get tested. If you feel that you have an area that you don't need to test that much, you can provide justification. But in Fresno, our goal is to test 1,500 individuals per day. We're not quite there yet, but we're on our way to being there. And I think I mentioned last week, and I would mention again this week, that there is a state contracted organization that's doing testing at Fresno City College and now in Sanger as well. And I believe there's some efforts they're doing about 100 tests a day on the west side of Fresno County too. And the state-sponsored sites are both sites that any of you, if you're interested in, can simply sign up and get tested. The test itself, I understand, is not a lot of fun. They take about a 6-inch Q-tip and stick it up, what I've heard feels like into your brain. But it would tell you whether or not you have COVID. As we've discussed previously, though, it's not an antibody test. So it only tells you if you have active COVID. The antibody tests are the things that tell you if you had COVID in the past, and typically at least 10 to 14 days after you've had COVID. And while I've seen in our community there are some antibody tests, including you can go through Quest and purchase a test online or get your health insurance to approve it for whatever reason, but you might have to pay for it. And so those are less reliable and still a lot of work being done on those. And so we're not doing broad antibody testing still. And then testing availability for at least 75% of the residents within a 30-minute drive time in urban areas or a 60-minute drive time in rural areas. And this just means when people want to get tested, they don't have to drive more than an hour from a rural area or 30 minutes from an urban area. And so I think we're pretty good there. We've got test sites available all over the county now, and we're not quite there yet on the testing, but we're getting close. All right, containment capacity. This is where we have sufficient contact tracing. And remember, contact tracing is where when someone tests positive, someone from public health or someone who's been hired by public health asks a series of questions about who you might have been in contact with prior to testing positive. And that is specifically within 6 feet for 15 minutes or more. And then they ask those people to isolate and quarantine as well. And so we would need about 150 contact tracers, and we're pretty close to that. So we're close there. And then availability of temporary housing units to shelter at least 15% of the county's residents experiencing homelessness. For us, this is about 300 residents, and we're well above that. So we've met this criteria. Next is hospital capacity, and this is where you have county or regional hospital capacity to accommodate a minimum surge of 35% due to COVID-19 cases, in addition to providing usual care. On a call this morning, I heard that we are well within this. Hospitals are very empty right now. A lot of people, we're having to encourage people through public health announcements to seek care for routine needs, that there is capacity in the system and it is safe to do so. And there's a little bit of a concern that serious illnesses are not being addressed right now because of that fear. Things like someone might have the symptoms of a heart attack or dealing with out-of-control diabetes or a pain that's unexplained or cancer treatments, all of those things we're really trying to focus on to make sure that people's health needs are met beyond COVID. But right now, we don't have a problem with hospital capacity, and so we should meet that. And then having a robust plan to protect the hospital workforce with PPE, both clinical and non-clinical. And I believe hospitals are looking at having at least a 30-day supply of PPE on hand, up to a 60-day supply, I've heard, with some hospitals. And the county can assist with that as well, making sure that we have proper PPE. As far as vulnerable populations go, this is our skilled nursing facilities where we have elderly who we know are much higher risk. I'm hearing numbers that in lots of states, the elderly are by far the majority of the deaths in that state. And so they want them to have at least a 14-day or more supply of PPE on hand, with the ability to procure from non-state supply chains, so that they've got a process in place where they're re-procuring and keeping that supply in place. All right, sectors and timelines. So basically what this just says is the county has to submit a plan with details on which sectors and spaces will be opened, what sequence, what timeline, and then they have to also identify triggers for either slowing down the pace through this stage or tightening modifications. And so that includes how often are you measuring things like number of tests you're doing, number of positive tests, number of deaths, and then the specific actions that will be triggered by metric changes. So if all of a sudden hospital capacity goes down, what will we do differently specifically, and how will we implement that? And then a plan to inform the state of any of these emerging concerns. Again, a county can request a variance to move through this stage quicker, and that would be for counties who largely are already meeting those other criteria. Some small counties have had very few cases, very few deaths, and have adequate contact tracers and such. So they might argue to go through this stage a little quicker. So I hope that kind of helped you. I know it helped me when I read through it to understand, okay, there's some actual like objective measures, things that have to be in place, and also that we're doing pretty well as a county towards getting there. It's going to be really important though, as we start reopening, that concept that we're measuring things and tracking it and really keeping our finger on the pulse. So I will tell you that on the calls that I participate on that are county-wide, we are asking hospitals, what is your capacity? How many tests have you done? How many people are in the ICU? How many ventilators do you have? And then you can see daily on the county's website how many cases do we have, how many deaths do we have. You can see a breakdown by community, by age range, et cetera. And so I really believe Fresno County is in a good position to both slowly, carefully reopen, as well as carefully track the effect of that reopening and understand where we might be having an outbreak or a problem, and if we do have an outbreak, having that contact tracing and the ability to contain the outbreak as much as possible by isolating and quarantining people. So that's really the end of my presentation. I always keep this in here, stay home if you're sick. And now I'm happy to answer some questions. Just a little reminder, I'm going to do a filler here because it's a little bit of a tape delay until I can answer questions. So what I will tell you in terms of counties that have to or want to proceed a little quicker, they have to actually have the daily capacity to do more testing, have a percentage of positive over the tests over the last 7 days is stable or declining, have plenty of people trained to do contact tracing. Maybe they don't have any long-term care facilities or correctional facilities, no homeless in their county, that type of thing. But they have to have pretty detailed information. And so it is objective, it is measurable, and counties have to work with the state in order to do that. But I will say that I've been impressed the last week that we are moving forward. I think that, again, there's been a tremendous amount of pushback, a lot of political pressure. There's a huge political divide going on, but I'm really proud of our Public Health Department, Dave Pomaville, my colleague who's the director there, as well as Ray Zvora, our interim health officer. They are just so steady and so capable and so consistent and supportive. And I really appreciate the guidance they've given us. Sometimes it's frustrating to find out you have to do something differently. The other thing I'll mention real quickly that I haven't mentioned previously is we are getting ready to develop capacity within our department to do testing. And so our colleagues, our partners with Exodus and Central Star, because they are our 24/7 facility operators, the adult PUF, the adolescent PUF, the crisis stabilization units, and the crisis residential facility, they are considered congregate facilities. And so we've gotten some of their nursing staff trained, and we're getting ready for them to be able to test any symptomatic individuals in their facility. And we're hoping to develop a schedule where they could also test more broadly for the department. So similar to what public health is doing right now, where you make an appointment and you can get tested by public health, we're hoping that we can develop some windows of testing within our department where those Exodus and Central Star staff would be available to test if we needed it. And so that's additional capacity for us with testing. It helps us get towards that goal, and then also it just provides for a quicker turnaround. We also know some of the facilities that we're sending our clients to out of the crisis stabilization would like someone tested before they come, and out of the PUFs sometimes want a negative test before someone comes. And so our ability to test ourselves can help facilitate client flow and allow them to move on to that better level of care for them. And we're also going to begin to do some surveillance testing more among our homeless population. And so those are additional to testing capacity for us and will help us get towards that goal to move on in the stages.
I don't see any questions.
Wow, I did good today. No questions. I don't mind questions. I'll give it a couple more minutes because I do want to answer any questions that you have. But I would encourage you to continue to follow the precautions. It's really helping all of us and will allow us to reopen in a structured way and hopefully not close again. I don't know about the rest of you, but my kids at home, they're starting to go stir, they're starting to lose it. And so I too want to get us to a safe reopening, but that's going to require cooperation from all of us. And I know I can count on all of you. Make sure you send the message to your friends and family. All right. See you next week.